G'day guys, it's Hayden from MMT here. Today I'm just going to talk about SIJ pain and what we usually see with the clients experiencing this sort of pain. So usually with the SIJ we see a lot of muscles kind of jamming that joint, especially through the thoracolumbar fascia. So you got heaps of muscles down there, and when they're really tight they just jam up that joint, especially coming from the glute maximus to be more precise, as well as the QL and the erector spinae. So through here, so the joint is around here through that kind of sacrum and in the pelvis area, with that obviously the vertebrae is coming down here. You can see all the nerves. They can have a bit of a nervy feel going down the leg sometimes. And just through up here, it's just all this fascia, just thick fascia. You see obviously the big glute max here. When that's really tight, can just those muscles kind of just jam that joint. And a lot of people, when they're trying to bend over or even just sleeping, trying to turn over, they'll get this really sharp pain. So what we're going to do, I've got Darcy here to kind of demonstrate. Just our lower back treatment will kind of fix this sort of issue. So kind of just in through here, people will just kind of point straight to that area. So what we'll do, we'll get some wax. And we'll just start off slow, doing our normal lower back sequence. We'll just come in here, kind of just sink into this tissue right over that joint and just melting that tissue away. So we kind of get down into those erector spinae that are running parallel to that spine, and sinking a bit into QL as we come out a little bit further. Yeah, that one's good. There'll be a lot of tension in through here. So a lot of the load through everyday life and everyday activities, the lower back cops it. Once those glutes really tighten up, the lower back will take most of the load. So yeah, we'll get the elbow into here and find that little junction of the vertebrae and the pelvis. Sink that elbow in. Yeah, that's really good, man. That's really therapeutic if you hit a spot there. Yeah. So we're just going to hold this spot for a bit. There's a bit of junk in here we want to clean out. Yeah. Oh. And slowly. Oh yeah. Slowly make our way out around that pelvis. By doing this, we're just kind of releasing the muscles that are jamming that joint in, freeing it up, allowing it to kind of function the way it should be functioning, allowing the body to bend, extend, rotate. Come here now, kind of find that spot again. We're just going to work up this big erector muscle that's kind of doing most of that jamming, causing that joint to become dysfunctional. So I can feel on Darcy it's quite tight, especially right near that spine, the erector muscle. Quite ropey, traveling nice and slow, putting a lot of purchase on that muscle. Next muscle I want to go to is just the QL. So I want to find that erector muscle and just slide off it a bit and just dig up and in into this, up in and under, which can be quite tender. But this muscle kind of lies a bit deeper, can kind of have that same effect on the joint too. Just has that jamming effect. Yeah. Oh.
Whoa. Ooh, that's good.
Just let that muscle slowly melt away. Really loosen up.
Oh. Oh.
It's starting to feel quite good. For the video's sake, we'll keep moving on. So the next kind of area I want to focus on is just through this glute kind of complex. So we'll start with glute med, that kind of wraps around the top there, and then we'll get into the big muscle, the glute maximus, which is having probably the big role in jamming that joint with that erector.
Oh yeah.
Find a good spot along there. Sinking in, hitting that glute med muscle. Quite twitchy, it's quite tight, which is causing that joint to become quite dysfunctional.
Oh. Yeah, it's good, man.
Just taking it nice and slow.
Oh.
Just bringing a bit of broader stroke, just getting those knuckles in there.
Yeah, feels good.
This one will be a bit more therapeutic to those superficial layers of the glute. And now, I just want to bring that up. Now I just want to kind of pin that glute max with my elbow. So kind of find that mid part of the glute. Sink in.
Sorry.
So we kind of just get the muscle, pin it down, let it melt away.
It's really good, man. I can start to feel some referral pain. It's going down my leg a bit, even into the glute and hip. If you really sort of come back that way and then hook up towards my back, that's how I could feel it the most. Yeah, in there.
Yeah.
Like that. Yeah.
You will get some kind of referral pain, as Darcy's said, just down the leg or into that hip.
Yeah.
It's all normal. It's all good. Just means we're on some good areas. We could just sit on this muscle for a good 5-10 minutes. Let it release and unjam that joint.
Yeah, I can even feel that into my feet and the bottom of foot.
Your feet and your foot.
Oh, that's right.
Well, that's pretty cool.
Right at the bottom of my plantar fascia, straight in the heel. It's weird. My right foot's like cold.
That'll be in the next montage, that one.
Right in my feet and actually
At the bottom of my foot.
the bottom of my foot joint.
Shoulder bone.
This is a really nice pain.
You got that really nice pain as you're sitting at your desk. Sorry, I'll plug this production up.
I'll start sinking out for the video's sake. But obviously we'd spend a lot longer on the glute and the lower back to really unjam that joint. So, and after the treatment we get you into the gym, really strengthening the glute and the lower back to make sure that it kind of prevents that pain from returning. So if you've got any of this sort of pain, if you've been feeling any kind of jamming in that lower back, feeling a bit immobile through there, come into MMT and we'll fix you up. Cool.
Fixed.
Fucking hated that. Who wants some goodies?
You got lemon balls.
Yeah, oh, mate.
I've got a big bowl of veggies. I don't think it'll mix well with that.